Hello, in this video series I aim to provide you with an updated version of the key concepts that you need to know so that you can easily master and be successful in a medical or doctor job interview. Hi, I'm Dr. Anthony Llewellyn, the career doctor, and I am a medical HR expert and coach. So in this video, I'm going to answer the questions. What is a professional scenario question? Why do interview panels like to ask these questions? And how should you approach answering such questions? So a professional scenario question is really any question where the panel presents you with an ethical or professional problem and asks how you would approach it. For example, the scenario might be about a patient declining consent for an operation, or a situation where you observe a senior doctor being rude and belittling another junior doctor for poor performance. At a resident medical officer level, it's generally quite obvious when you are asked or being confronted by a professional or ethical scenario. However, for registrar or trainee level jobs and consultant jobs, certainly the professional scenario may be merged together as part of a clinical scenario. However, it is still generally quite obvious that there is a professional or ethical aspect to the question. In either case, we can use the SPIES framework to help us navigate these scenarios. SPIES. In SPIES, S stands for seek information. In other words, gather as much information to help you make an informed judgment about the scenario and don't rush in to judge too hastily. So this might be about gathering more information about the patient who's not willing to give consent. For example, have they had the procedure properly explained to them? P stands for patient safety. Always consider any harm that may occur to the patients in the scenario. So if you see a senior doctor being rude to a junior doctor, is this happening in a clinical space? And can patients observe this? If so, this is going to reduce their confidence in the clinical team. I stands for initiative. So these are the actions you're going to do or take. Now there may be a number of actions, but usually a core action in the professional scenario is about having a possibly difficult conversation. So again, coming back to our senior doctor belittling a junior doctor, how are you going to stop this from happening? What are you going to say to the senior doctor to get them to stop? E in SPIES stands for escalate. Do you need to bring this issue to someone else's attention? For example, with our patient declining consent, does the consultant need to be informed and ask for advice about what to do? Finally, S in SPIES stands for support. This is a reminder that ethical dilemmas or professional scenarios are often not resolved immediately. There may be after effects. So in the case of our senior doctor belittling a junior doctor, there are a number of parties in this scenario who are going to need some support. Firstly, the junior doctor who may be feeling uneasy or scared about coming to work. Secondly, the senior doctor who may be having some personal problems, but in any case needs to correct their behaviour. Patients, family and staff who witness the behaviour. And finally, yourself, who may be feeling a bit vulnerable having to step in the middle of a tricky situation like that. But that's how you approach a professional scenario utilising the SPIES framework. Now, if at any point you feel that you've gotten value out of this video or video series and want to dive a bit deeper into mastering the doctor job interview process, then I highly recommend you check out my Doctor Job Interview Skills course. This is where I do a much deeper dive into each of these question types, along with other questions and a lot more concepts to help you successfully excel in the process. For example, in the course I go over in a lot more detail how to approach common professional scenarios and how to signpost your answer to these scenarios. If you click on the link in the description or at the end of this video, you can purchase this course for a special discount just for watching the whole way through my video. And I'll see you in the next lesson.